Everyone, and welcome to this week's COVID-19 office hours. We've got a full agenda of content today, but before we get to that, we're going to spend just a couple moments going over some housekeeping and technical notes. So first and foremost, I do want to remind everyone that we are recording today's office hours, and we'll post a copy of that recording along with the slides and the content from the chat to the HUD Exchange. Just please give the team a couple of business days and they will make sure that those materials get posted at the link that is up there on your screen now. Additionally, if you have any challenges connecting to audio during the webinar, we encourage you to switch over to the phone audio information that is up there on the screen right now. Phone tends to be a little bit clearer for folks, and you can dial into those numbers that are both up there on the screen or in the chat right now at any time. Everyone that's here as a participant will remain muted for the duration of our time together today, but we do hope to and anticipate hearing from you through the chat feature. So if you're not familiar with where to find chat in WebEx, go ahead and look at the bottom right-hand side of your screen. You'll see what looks just like a message bubble. And when you click on that, it will open up the chat functionality for you. Please send all questions, comments in through that chat feature. And when you send them in, please just take a moment to make sure that they're going to everyone. It should default to everyone, but if not, go ahead and find the to bar and go ahead and scroll down until you see everyone. And with that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm.
Thank you so much, Natalie, and welcome everyone to our session today. As Natalie mentioned, we have a packed session. We got a lot of great presentations for you. So thank you all for joining us on this Friday afternoon or morning for some of you. So as you can see, we have several people from the SNAP's office and from other parts of HUD, including our Office of Public and Indian Housing, who are here to provide information and to serve as resources if you have any questions. As Natalie mentioned, if you have any questions about the content that we cover today or about any other topic you want to ask a question about, please feel free to type it in the chat window and we will do our best to answer as many of those as we can. Moving on to the next slide, we have some other federal advisors and resources here. We will be hearing from the Centers for Disease Control and Prevention. Ashley Meehan will be giving us our update. We have some members of the Department of Veterans Affairs, the National Healthcare for the Homeless Council, and a few other federal resources here, again, to help answer your questions. Moving on to the next slide, we have a couple of really exciting guest speakers that I'm very happy that we get to hear from today. And as you can see on the screen, we have Lindsay Richard, Peer Ambassador and Coordinator from the LA County Department of Health Services, and Condencia Braid from the National Organization of Sisters of Color Ending Sexual Assault. So we will hear a couple great presentations from them. So again, very excited to hear from them. So moving on, we'll go to our first presentation. We're going to get our regular CDC update from Ashley Meehan. So Ashley, over to you.
Thanks, Norman. Hi, everyone. It's so good to be with you. My name is Ashley Meehan, and I am a health scientist at CDC working on homelessness. So we can go to the next slide, please. Excuse me. So here is what our cases are looking like over time. It's our trend line. If you look really closely, sorry, it's not bigger. Around April 27th, we can see that red line, which is our 7-day moving average of cases, it is starting to go up a little bit. Nothing super drastic, so that's a good sign. But there are some more cases that we're starting to see than we were, a month ago. So just want to flag that for your awareness. And we can go to the next slide. And how that translates onto our COVID-19 community levels, we are seeing more counties moving out of that low green level and up into the medium and high levels. So again, what's really important to look at here is that percent change in that far right column. So we are seeing some increases in the percentage of counties that are in the high and medium levels. And when looking at the map, you can see that the Northeast, particularly New York State, really is moving up into that high level. So again, it's moving kind of slowly, so that's maybe a good thing. And we are keeping an eye on it, but overall, most counties are in the green level and looking pretty good in terms of both transmission and in terms of severity and burden on the healthcare system. So that's overall still a good sign. Next slide, please. I do want to draw attention to some emerging sublineages of Omicron. So we share these graphs, every office hours, and every office hours, I feel like it changes a little bit. So we were keeping an eye on BA.2. Now we're looking at BA.2.12.1. So that's a tongue twister for anyone interested in practicing that. Again, this is the percentage of cases reported that belong to that lineage. So, these new cases that we're seeing could be or are increasingly due to this new lineage of Omicron. This doesn't really change much in terms of what we know and how we respond. So not really changing anything in terms of our day-to-day operations just yet. Next slide, please. I do want to share about a new publication that actually just went live this morning. It's about some lessons learned in responding to COVID-19 among people experiencing homelessness in the United States, particularly from a public health perspective. So we talk about some of the things that we learned that were important to respond in this setting and for this population. So we can put the link in the chat, and if you're interested in reading, we'd love to know if it tracks with what you've learned during this pandemic as well. So just wanted to share that is live. And if anybody wants to talk about it, we'd love to talk about it too. So just sharing that. We can go to the next slide, please. And that's all today. I do want to revisit the conversation about our updated guidance documents. As to be expected, I think it's moving a bit slower than we had hoped. We were hoping it would be live to discuss today, but unfortunately it's not. But I promise you, as soon as it does go live, we will make sure to talk about it in a good bit of depth on the subsequent office hours session. That way you all know what the updates are, what our recommendations are, and how to move forward. So just wanted to close the loop on that and let you all know that it's not forgotten, and we will cover it as soon as it's available. But our clearance process is just moving really slow as usual, unfortunately. So that's all from me. I'll pass it back to you, Norm.
Thanks so much, Ashley. And we definitely appreciate the new resource and also are eagerly anticipating the new guidance. So thank you for providing us with those updates. We're going to move to our next presentation now. I'm very, very excited to introduce Condencia Braid, Executive Director of the National Organization of Sisters of Color Ending Sexual Assault. So Condencia, I'm going to turn things over to you.
Thank you, Norm. Thank you so much. And good afternoon to everyone, or good morning if you're calling in from a different time zone. Thank you so much for the opportunity to be able to engage with folks today. I'm very thankful for it. It's so important that I'm following the CDC because I really do, as an organization, we see sexual assault as a public health problem that really requires a comprehensive and community response. During April, we acknowledge and raise awareness of sexual assault, but always reminded to say that we should be thinking about and responding and addressing sexual assault every day. Unfortunately, it continues to happen far more often, and we really need to be intentional about thinking about what do we do, what can each of us do, how do we, as my colleagues say, do our part to put an end to sexual assault. So today, in my brief comments, I want to discuss a few things with you just to be thinking about. One is I'll give a quick snapshot of what drives homelessness and safe housing needs for survivors of sexual assault. And then I'll talk a little bit about some considerations of housing providers and programs. What can you do in your role to support survivors of sexual assault? First, I will say our organization, CSA is what we are called. We work in partnership with other national sexual assault organizations to look at the broad scope response to survivors of sexual assault and their housing needs. And we also engage with our fellow culture, civic, community of color organizations, the national level, to look at these issues as well. So a quick snapshot of what drives homelessness and safe housing needs for survivors of sexual assault. Sexual assault and harassment can be a risk factor for homelessness, and homelessness is at the same time a risk factor for experiencing sexual assault. What we know is that sexual assault can happen anywhere, and far too often the anywhere means in a person's home. In fact, it's noted that the majority of sexual assaults take place in or near a victim's home or the homes of victims, friends, relatives, or neighbors. Sexual assault can occur in home by a family member or a neighbor. The survivor may need to move for their safety or to heal from the trauma experience and the constant triggers that are re-traumatizing. The context of being in the space where harm was done, knowing that your safety and security was broken once and at any time can be broken again. The pandemic and the response reminded us of how many sexual assault survivors are trapped in their home with the harm doer. Sexual assault may not, when it doesn't happen in a home, it can happen by someone in the neighborhood, and the harm doer, or what we call the person who perpetrated the sexual assault, the harm doer may know where the person lives and has threatened the survivor that they will return. Sexual harassment and assault by a landlord happens far too often, and it's vastly underreported. In fact, in a listening session that we held with women of color survivors across the country, we were told time and time again that they don't feel like if they told someone about what was happening to them by their landlord, that anything would be done. And instead, they would be left to having to deal with further assault. We may also have a survivor who can no longer afford rent because they lost their job due to the trauma, especially if the sexual assault might have occurred in the workplace and they are not safe to return to that workplace. They're struggling with trying to figure out what to do and how to get support around that context, and as a result, may not be able to continue at work or may have to leave that work, and then are not able to afford or pay their rent, utilities, et cetera. And what we see is that oftentimes survivors in that context may be left with not being able to find a safe place to live and unfortunately being homeless. We may have a survivor whose grades might have fallen because of a trauma of being sexually assaulted, and as a result has lost the ability to return to campus, or a survivor that I'm working with, they lost their scholarship, which paid for their housing, and so now have nowhere to live. We may also have a non-offending parent where that's where the child is being sexually assaulted and the non-offending parent leaves the home in order to protect the child. So I work each day with survivors of sexual assault and the programs that serve them, so I can give you far more examples, but I just wanted to give you a snapshot because oftentimes when we talk about sexual assault and housing needs, it becomes complicated for folks to understand, what do we mean and what may trigger the need for safe housing and homelessness for survivors of sexual assault. So I just wanted to then move on to just give you some things to think about for those of you who are housing providers, working at housing programs, working at homelessness programs and responding to issues of homelessness. I wanted to give you some things to think about, just some considerations that can support survivors of sexual assault. And I'll keep it a brief list. One that's really important is to recognize that domestic violence and sexual assault are not the same thing. Often when we think about the housing needs of victims of gender-based violence, we think of domestic violence. And it is very important to make sure that there are resources and support to address survivors of domestic violence. However, domestic violence and sexual assault are not the same thing. They may have similar societal underpinnings, but the occurrence, context, and support mechanism needed for sexual assault survivors are different. We must be careful not to silence the voices and experiences of survivors of sexual assault by not acknowledging their victimization, trauma, and needs. In our series of listening sessions, I like to quote, one survivor said it, it was so real to hear, her response. And the response was that sometimes survivors are denied assistance and sent to a domestic violence shelter. And she said, sending a sexual assault victim to a domestic violence shelter shames the victim. It is important that you understand your knowledge points around sexual assault and seek opportunities to learn more information about sexual assault. And if you yourself is in a leadership position, be intentional about providing training for your staff around the issues of sexual assault and the needs for survivors. Not understanding and knowing the complexity of sexual assault is consequential and can unintentionally harm a survivor. It's important to recognize that survivors have to define what safety means for them. Many survivors have multiple incidents of sexual assault. Most of the time, when we think about women of color that are seeking safe housing, they have significant mental health and trauma issues. Some of them have experienced sexual assault either before being homeless or during a period episode of homelessness. And so we have to be mindful of not letting assumptions about sexual assault or women of color determine whether you think a survivor may need assistance. Far too many women of color that we spoke to talked about not being validated for their incidents of sexual assault and not feeling like they have access or ability to engage with homelessness programs. I also want to talk about, just as I'm wrapping up, the importance of collaborating with community-based sexual assault programs. Many of you might be engaging and working with domestic violence programs, which of course is important and needs to continue to happen. However, that is addressing domestic violence. You need to also be communicating, collaborating, engaging with sexual assault programs. And I highly, highly suggest that not only engaging with mainstream sexual assault programs, but also with culturally specific communities of color organizations that are addressing sexual assault in your local community. It is so important to work with these agencies. And I want to be intentional of saying communities of color organizations are not just about organizations that are led by a person of color, but communities of color organizations are created by and for the communities of color they work with. Their primary mission, focus, and goals are on the communities of color they're working with. I implore you to be intentional about reaching out to communities of color organizations because many communities of color organizations are not a part of their local continuum of care. Often these communities of color organizations have lack of resources and do not have access to the continuum of care in their local community. So again, I implore you to reach out to them. They are best suited to work with you on addressing the housing needs of communities of color who are survivors of sexual assault. I know that I'm taking up time and hopefully I haven't gone over time, but I want to thank you all so much. I so appreciate the opportunity to connect and share just a little bit of the work that we're doing and lifting up the needs of survivors of sexual assault. I will put my contact information in the chat. If you have questions, want to engage and talk more, I am so wanting to connect with the work that you all are doing and figure out ways that we can work together. Again, thank you. I will also be putting in the chat the link for the National Sexual Violence Resource Center. They have a plethora of information on sexual assault and housing in their resource collection, so I will put that link into the chat. Thank you again, and I'm going to turn it back to Norm.
Thank you so much, Candencia. And I think Latoya beat you to putting the link up. So I would strongly encourage everyone to find out about the resources and the organizations that provide assistance to sexual assault victims in your community, and also not only reach out to them from the continuum of care, but by all means invite them and encourage them to participate and to be active members of the continuum of care. This is such an important area of needed collaboration. Candencia, I want to ask you just sort of a couple follow-up questions. You mentioned some listening sessions that you did, which we definitely appreciate, and just want to hear what are some of the tips or suggestions you have for organizations that provide homelessness assistance to make their services more welcoming to sexual assault victims? What are some things that you would suggest to those organizations?
Thank you, Norm. I think, one thing I would say is to look at the information that you are putting out. I think, sometimes when we talk about the services that we provide and, who we can help, that is important to name sexual assault and survivors of sexual assault in that information so that survivors know that this is a place that they can go to get assistance. I think, so that is like one, key thing. I think it's always important when you're engaging with folks to look at opportunities to, how do we ask, about the resources that you may need in a way that allows for survivors to be able to tell you, what does safety mean for them. That was something that we heard over and over again is, having folks be able to allow the survivor to talk about what the safety means for them and being flexible in terms of recognizing that a survivor of sexual assault may not be what we think of fleeing from an assault, but may, again, have, a myriad of issues that are related to the trauma to sexual assault that is increasing their need for housing assistance. So being mindful of that.
That's great advice. Thank you so much. Also, I wonder I'm wondering how you would suggest that continuum of care leaders and other sort of organizations that want to partner with organizations that help sexual assault survivors, like what's a good way for them to identify organizations in their community that are working on this, and particularly organizations that serve people of color and maybe some other sort of marginalized groups? What would you suggest for how to sort of reach out and where to identify the organizations in your community that are doing this great work?
Sure, and I want to answer that. I'm going to jump back 1 second to the other what I also noted in the chat as well. So first to answer that question, I think what you can do is certainly in many communities around, there are organizations that are, if you look and begin to look for sexual assault survivors, sexual assault programs rather, there are a plethora of them that are, some may be connected to their local sexual assault coalitions, but I think what you can also do is, and I will put our link in the, for CSA in the chat, but we also have a national communities of color organizations that we have lists of sexual assault organizations that are in communities of color that are on our website. And then also the National Sexual Violence Resource Center, our organization works to send them a list as well. So when you look on NSBRC, you'll be able to find that link. Again, you'll find that on CSA's link as well, which is, again, I'll put that in the chat. And we have a list of the communities of color organizations that are around the country that is responding to sexual assault. And honestly, if all else fails, you can email me. I have people email me all the time, or you can, and I'm happy to, if you cannot find the information for your local community, you can email and ask for that information, and I'm happy to let you know. But I will put that link in. And then I do want to go back really quickly. There was a question about trauma-informed training. Absolutely 100%. I cannot tell you in our listening sessions how many housing providers say, we want to learn more about sexual assault. We want to know more. We have seen people that we think they're sexual assault, or folks have said to us that they're sexual assault survivors, and we don't know what to do. So I think, so to the question that Norm, you posed, what can homelessness programs and housing providers do? Absolutely 100%. Training on sexual assault, engaging with sexual assault organizations.
Thank you so much. And if your website, do you also have resources, or can you suggest resources for where an organization might get good training on serving sexual assault survivors?
I think when you, I would say engaging with your the sexual assault organization in your local community. And again, you can get that list from NSVRC. And also for communities of color organizations, engaging with the culturally specific communities of color organization in your community that is responding to sexual assault. I think they would be best equipped to provide you with training that is specific to your community, and hopefully this will be a start of an ongoing relationship.
That's fantastic advice. Thank you so much. And I just want to stress to everyone how important this issue is and how much we encourage you to reach out to those organizations and really form and strengthen long partnerships to help survivors. Thank you so much, Candencia. Really appreciate you coming on and sharing this information with us.
Thank you.
So we're going to move on to our next presentation. Very pleased to introduce Lindsay Richard, Peer Ambassador Coordinator for Housing for Health in the LA County Department of Health Services. So Lindsay, I'm going to turn things over to you.
Wonderful. Thank you so much, Norm. Hello, everyone. Happy Friday. As Norm stated, my name is Lindsay Richard, one of the Peer Ambassador Coordinators for DHS's, or the Department of Health Services, Peer Ambassador Program in LA County. Next slide, please. So just to give a general overview of what the Peer Ambassador Program falls under, it falls under Department of Health Services, Housing for Health's COVID Response Team. And the COVID Response Team operates mobile COVID mitigation programs in shelters, street-based settings, unsheltered settings, and permanent supportive housing. And this is throughout LA County. We provide services such as risk assessments, technical assistance, COVID testing, and one of our main goals being COVID vaccinations. I wanted to provide an important piece of information in regards to our data and how well our COVID response team has done. A total of 40,214 vaccinations have been administered to over 20,970 distinct individuals. A total of 14,281 distinct people experiencing homelessness have had at least one dose of the vaccine series, and 10,501 people experiencing homelessness have been fully vaccinated. So there is amazing work being done within our COVID response team, and the Peer Ambassador Program has a lot to do with that. So with that being said, I will go into further of a general overview of our Peer Ambassador Program. Next slide, please. And so when speaking about our Peer Ambassador Program, I think it's very important and crucial to discuss a small glimpse of the medical mistrust. The PH community continues to confront a long history of discrimination and negative interactions with medical services, from unethical to immoral experiences and overall exploitative situations. Specific to the racial and ethnic minorities of the PH community, they've been disproportionately affected, which is a contributing factor to medical mistrust overall. So with these main and important topics in mind, we wanted to enlist the assistance of peer ambassadors of the community that know their community and are willing to come on and volunteer and act as bridges so that we can provide these much needed and important services to those in need of those. And next slide, please. So the Peer Ambassador Program has been operating since September of 2021. We have peer ambassadors that are either currently people experiencing homelessness or formerly people experiencing homelessness that are interested in basically just volunteering and sharing their story and promoting the vaccine in and around their communities. Generally, our peer ambassadors are brought on a same-day basis. So when we're at vaccine events, we'll the audience and interact with those that have been vaccinated and to see if they want to be peer ambassadors for the day. They're working with their whole team, but primarily they interact more so with their community outreach workers as they are assisting with outreach efforts. So our peer ambassadors are compensated for their time, which is through a $25 Visa gift card for every hour volunteered. We like to use the messaging of they are helping us. We're not helping them, they're helping us. So making sure that we compensate them for their time is very important. Next slide, please. So there are eligibility criteria that our peer ambassadors must meet. First and foremost, they must be vaccinated, and that can just mean a minimum of the first dose. They must be a person experiencing homelessness or formerly a person experiencing homelessness. They cannot be a danger to themselves or others, and there are our limits, and the main one being the maximum of 23 hours in total for a calendar year. This is more so for IRS tax reporting purposes. We don't want them to have that extra layer of stress, so our peer ambassadors can volunteer a maximum of 23 hours in total for the calendar year and can volunteer a maximum of 8 hours each day. Next slide, please. So what do our peer ambassadors do? Well, they do a lot, but the main points that they do are assisting with outreach and passing out flyers, sharing their vaccine stories, as I stated before, their overall experience of being vaccinated, what made them want to be get vaccinated. And lastly, assisting with passing out hygiene kits, harm reduction kits, and snacks. Really, it's us sort of engaging with them and seeing what they're comfortable with and what they really want to help with. We really emphasize strength-based approaches. Next slide, please. So to share some of our outreach flyers, we have the next vaccine clinic flyer, the save the date flyer that we pass out. Maybe our clientele can't meet the vaccine for that day, so we'll give them information on various other events and when we'll be in that area next. In addition to our COVID-19 wellness and vaccine guide, sometimes some of our clients aren't ready to get vaccinated, but they really want to be informed on both COVID overall and the COVID vaccinations. In addition to our peer ambassador program, we have many people that are interested in being peer ambassadors, but maybe for that day, they don't have the time to volunteer with us. So we'll give them that information. And when they are ready, they can reach out to us and we can navigate certain situations so that they can volunteer. Next slide, please. So what have we learned? We've learned a lot, honestly. It's been really a joy. First and foremost, to build confidence, communities should hire vaccine ambassadors with lived experience. They know their communities. Allowing them to lead is extremely important and crucial to not only engage with people experiencing homelessness, but also to homeless service providers. We have worked with more than 250 individual peer ambassadors at over 280 locations, and 30% of the vaccines given out at these locations can be partially attributable to peer engagement and peer ambassador work, meaning that it does work, that the research and that the data behind it shows. On average, we see that we vaccinate one more person per hour at vaccine events with peer ambassadors, as opposed to those that do not have peer ambassadors. So just really honing in and driving that message of peer ambassadors are important pieces to the community-based work we do. And with that being said, next slide, please. I also wanted to share some really amazing links. The first one being our COVID response team webpage that lives within the DH LA County website. We have a plethora of resources and printable outreach flyers and pieces on our peer ambassador program. And the second link is a wonderful article written by the LA Times in regards to our peer ambassador program. With that being said, next slide. Alrighty, well, thank you all for your time, and I just wanted to see if there's any questions, and I'll also put my contact information in the chat. Let's see here.
While you're doing that, I just want to thank you so much, Lindsay. That's first of all, it's great, great program structure. Also great to see the data you've been able to generate and the improvement in outcomes for events with peer ambassadors. I think it's I mean, one additional vaccination an hour doesn't seem like much, but given how important it is to vaccinate people and that vaccination can be a slow process, that's a great result and great to hear. I do have a couple follow-up questions I wanted to ask you about. Can you talk about how you recruit peer ambassadors? Did you do special outreach, or can you talk about how that process works?
Yes, so at our vaccine events, which we have them daily in different spas of LA County, we're basically interacting with those that arrive to the event. And for many situations, there will be an individual that's receiving maybe their second dose or first dose or booster, whatever it may be. We'll engage in conversation and tell them about the peer ambassador program, and ultimately just leave with that question of, would you like to volunteer with us? These are some things that you can assist us with, and you will be compensated for your time.
And so you're able to get a lot of volunteers just by reaching out while people are getting vaccines. That's interesting.
Yes, correct. And we've had over now well over 200 peer ambassadors. So it's really amazing to see.
That's great. For those of you not from Los Angeles, a spa is not a place where you go to get your skin cleansed. It is. Can you talk about what a spa is in Los Angeles?
Yes. I keep forgetting. My apologies for that. Yes, so basically it's a specific area within LA County. As everyone knows, the county is pretty large, so it's sort of divvied up in different categories. So we'll have Spa 1, Spa 2, 3, all the way up to Spa 8. That just kind of outlines a specific area within LA County.
Great, thank you so much. And can you talk about what kind of, do you provide additional support for volunteers, or what kind of additional support do you provide for the peer ambassadors?
Yeah, so during outreach, we're always with them. So making sure that they're comfortable with the sort of work that we're doing, as for many of them, this is a new experience, but also a new opportunity. It can open so many doors as far as being put on resumes and us assisting in any way that we sort of really can. So it's main sort of just offering that main support it's what is really important.
And do you typically staff that with the people who would normally be at a vaccination event, or do you bring in additional staff for that? How do you sort of organize that?
Yeah, so we usually staff with the staff that will be scheduled for that event. However, let's say if it's a larger event and we know that there would be a lot going on, we'll bring in additional staff to assist.
Great. Well, thank you so much, Lindsay. Great to hear about how well that's going. And did you say you've had 2,000 peer ambassadors so far?
Over 200.
Over 200, okay. Still a lot.
Yes, a lot. Mm-hmm.
Very exciting. So thank you so much for presenting with us today. If you have any questions for Lindsay, please go ahead and type them in the chat window, and I think she'll be happy to stick around and answer some of your questions. With that, we're going to move to our next presentation. We're very happy to have two members of the HUD team who work with the Emergency Housing Voucher Program, Mike Larisha and Emily Warren, who are going to give an update on the EHV program. So Mike, I'm going to turn things over to you.
Thanks so much. First of all, thanks to all the COCs out there for all the work being done to get these 70,000 emergency housing vouchers issued and leased. This is the first time we've had this very formal working arrangement. There's been a lot of cooperation with a lot of COCs and PHAs, but this is taking it to another level, and hopefully it's sort of a force multiplier. But we're working out kinks, right? It's the first time, and doing some very detailed stuff, and folks are doing a great job. Let me go to the next slide. I want to give you just a quick sort of update, high level. First of all, if you're not as familiar with this as you could be, this is the place to get the information on HUD's website. A lot of information there, including a dashboard with so you can monitor every community and what's going on with it. Next, please. So this is such a varied program. We're dealing with tiny communities and the largest cities in the country. So the 26% leasing we have now is different when you break it down by the size of communities. I thought this would add some insights. So this is on the bottom axis, there are the different size categories of program, 15 to 50, et cetera, all the way up to, thousands. So the two smallest size, 15 to 50 and 51 to 100, are over half of the programs. We have 614 PHAs, over half the programs, and those are the highest leased in the country. And probably because it's easier to get a small program off the ground than a very, very large one. They represent, though, even though they're like 57% of the organizations, they represent 24% of the vouchers. Then, as we move up, interestingly, the size of the program, there's a diminution in the leasing down to the very largest New Yorks and Los Angeleses and others, where we've got 23% of the EHVs and 2% of the PHAs leasing at 10%. They sort of got a later start as we were building systems and getting things going. It took a lot to get off the ground on some of these large, complex organizational marriages, but they're worth the time. It was an investment, is the way we see it. Next, please. So I want to talk about one other thing that is very unique about this program, and that is the funding of a service fee, $3,500 per household. And I want to give you an idea of how that's being used. We get this reported through PHAs on their financial reporting to us monthly. I'm hoping there's a bit of a reporting issue because we have not had a lot of spending done yet, but where we have, this is how it breaks down. About 20% each is going towards housing search assistance and owner incentives. And then the largest category by far are helping participants out with security deposits, rental applications, holding fees, et cetera. And then a catch-all, 26%. Next, please. So in terms of them, we have $244 million funded to do that. We spent a little under 5% of that so far, even though there's 26% of the units leased and over 50,000 issued. Again, the breakdown on the money is as follows. As I was saying before, the security deposit's the big item, and then the other ones are almost even. But this service fee seems to be a key in helping this program work where they're being used actively. And so we're going to continue encouraging PHAs and COCs to actively use this and report it correctly so we can get a good handle on it. Next, please. So one of the challenges, we know that we're in probably the most difficult rental market in recent memory, trying to house one of the more challenging groups, right? Under-resourced groups. And as a result, we've been tracking success rate. We get from the PHAs, and we're getting very good reporting on this, the number of vouchers issued, and we're looking at it by week. And as we age these things, we're seeing that the success rate seems to be in the 60% range, roughly. Even when you get out 6 months, someone's had a voucher, you sort of say after that, it's sort of not much return on that. We need to improve that. That 60% is not out of line with what we've heard is the success rate for the voucher program in general. Unfortunately, we'd like it to be higher, but a lot of activity. So anything we can do with these service fees and collaborating with partnerships on the ground to improve that is going to make a big difference. Next, please. So how long does it take to get these vouchers leased once they've been issued? Well, it's been taking an increasingly longer part of time. And obviously, as we have more time behind us, that'll reflect that. But the other thing we're seeing is it really is taking more time. In April and May, we're at around 100 days of those families that were out there. The 18,000 leased here, we see overall has been 70 days, but it is growing to be much north of 90. Again, this is also, I think, partly due to the larger programs that have gotten under steam in the last 2 to 3 months in terms of issuing and leasing. Next, please. So let's put under a microscope the sort of almost 4,000 that were leased in the last couple of months to give us a current sort of view on how long it's taking folks to lease a unit. And you can get the picture there. 23% of them in 60 days, another 43% between 60 and 120 days. And at the tail end there, a little under 1% in 180 days and 80 days and up. So we're seeing these longer days getting more prevalent, but we can see that it takes a lot to keep up with this. If people are out there for that long searching, the kind of search assistance and case management that these partnerships provide for are really being critical in translating these longer looking periods into hopefully more fruitful finding of units. Next, I think that may be it. Yeah, I wanted to give you a very high level look at what we're seeing and not take a lot of your time. But clearly the role that you're playing is really different and really critical in this effort than anything we've done before. And we're learning constantly as we go through this and sharing. There's EHV office hour recordings you can get on the EHV website. And there's some really good material out there of your peers and PHAs discussing what they're doing. Thanks, Norm.
Thank you so much, Mike. And it's great to see, it's been great to sort of watch this initiative sort of blossom and get going. And certainly there are a lot of challenges. And I feel like we share a lot of challenges, right? Like in the COC program, the process of finding units and engaging landlords has been incredibly challenging. And this housing market is, it's a tough one. Can you, like, what are some of the strategies you've seen PHAs engage in that you feel like have helped move the needle on some of those more challenging housing markets?
Well, we're just on a sort of a conference call with some Pennsylvania and Delaware housing authorities a couple of days ago, and the housing authority in Reading is doing a great job. They're fully leased up with their 50, I think they have. But they're, in addition to being really efficient at working together by meeting regularly and little things like paperwork holding things up, getting past that, where they focused is using a landlord liaison dedicated to this program and using the extra fees that have been provided with this program to do that. And the way they happen to do it is by working overtime and weekends rather than trying to hire staff. Staffing up is a real challenge right now, and we're seeing that being a delaying factor. So the fact that they were able to take advantage of their current staff quickly, as well as the COC staff, made a huge difference, even in a tight market. Plus, there are waivers and adjustments made in the rules. Housing authorities can go up to 120% of the payment standard of the fair market rent, whereas normally it's 110% of the fair market rent is the ceiling for the payment standard. So the EHV, participants have a higher buying power if the PHA will choose to do that. So we've been encouraging that, and many PHAs that have done that have at least added that to their arsenal a little bit.
Yeah, and I would just love to echo that and put an exclamation point on it or whatever emoticon you put with those things. I noticed that Brian helpfully put a link in the chat window to some earlier presentations we've done on EHVs and landlord incentives and such. But we've been dealing with difficult housing markets for a long time, and they're probably not going away soon. And it's probably worth having sort of just an ongoing landlord engagement and landlord liaison function that is, always working to find units and landlords, whether it's for PHA units or COC units or local subsidies. this sort of like muscle of having the ability to engage landlords on an ongoing basis and really sort of bring units into the mix is just going to be an ongoing need, and certainly worth thinking about how do we make this a permanent part of our toolbox in our housing and homelessness work.
Sure.
If people need additional information or they want to like learn more about best practices or such, what would you suggest that people do?
Well, first I would recommend they go to the website. We've got a new document there as well, which is just came out that's got best practices in it and other things. Emily, I'm not sure, we just have them send it to the email site for the site?
For questions, yes, to ehv@hud.gov.
And people can ask questions about program rules or questions about best practices, or can they just send any kind of question, obviously related to the EHV program that they have there?
Sure.
Great. Well, thank you, Emily, Mike, thank you so much for coming on and providing us with that great update and recommendations. We appreciate both the information here and the ongoing partnership. I just so strongly agree with your comments at the opening, Mike, about how important this partnership is and how I feel like communities have really stepped up and created these great links that in some cases they existed before and they were just strengthened, but in some cases they had to do it from scratch. But this is an important platform for us going forward, far beyond just the EHV program. So it's been great to see.
Great.
Thank you so much. So thank you, Mike. We're going to move on to our next presentation now. I'm very happy to introduce Brian Roccapriori. And as you can see, he's going to share some information about a couple TA products on isolation and quarantine and isolation in place. So Brian, I'm turning it over to you.
Thank you, Norm, and hi, everybody. Brian Roccapriori. I'm a TA provider working with HUD's disaster response team, and I'm here today to highlight those two documents on the screen right now, which have been recently added to the HUD Exchange. So on the next slide, the first is the very literally titled Alternative Approaches to Isolation and Quarantine Spaces. And we put this out now because in a lot of communities, there's a shifting landscape of available options, and what's available today might not be what was available last month. And also takes into account that not every community is the same, and each community is going to have, or not going to have, the same complement of options that are available to them. Some places are going to have ample non-congregate shelter space that you can use. Some places are going to have recently closed all their non-congregate shelter, and some places are just never going to have had it at all. So what this document does is provides folks with a framework and a good, better, best approach to isolation and quarantine, ranging from isolating and quarantining residents within a shelter facility to exploring the better options of non-congregate shelter. So the link for that should be going into the chat right now and goes over several different things like staffing considerations, COVID mitigation efforts, facility considerations, and it does spend a lot of time talking about those facility considerations, because there's not a one-size-fits-all emergency shelter. Those are different from facility to facility. And I've presented on office hours a couple of times now, and if you have seen me here before, you have heard me say this, but I'm going to keep beating the drum, that these decisions should not be made alone. They should be made in concert with your local public health officials and with people who you're serving, so folks who've experienced homelessness. And generally speaking, shelters aren't public health experts, and we really should be relying on our public health partners for their expertise in these situations. There's been a ton of great partnerships that have formed in the last 2 years, and we don't want them to all just fade away. So keeping those partners engaged, those healthcare for the homeless partners, those health centers, the hospitals, whatever, is going to allow you to quickly activate them in the future if they're needed, and really allow communities to act with urgency without having equity take a back seat to there being an emerging need. So on the next slide, we have our second document. which builds off of the last one. And this is shelter-based isolation in place guidance, which is a guide for how shelters can think about using their various designs to provide isolation in their existing spaces that works for both the space and the population. Condensia was on before, talking about Sexual Assault Awareness Month, and that was a great presentation for like this document specifically, because the needs of a victim service provider could be very different from those of a large overflow shelter. So it gives a number of different options that are adjustable to the shelter that folks are looking to implement these, excuse me, to implement these practices in. So again, non-congregate shelter, it could be full or might not be an option in communities, and really making sure we're working with those public health officials on implementing this approach. What you can expect in this document is some super practical information about how process decisions can get made for implementing this, and then more about how to implement those decisions once you've made them. It goes over all the things you're going to want to consider when implementing something like this, from testing and screening to those facility considerations to infection control, and then goes on to provide some community examples where this is actually already done and been in practice. So one of those examples, Los Angeles presented on their isolation in place on these office hours back in January. We should be putting a link to that in the chat right now. And if you want some practical application of how that would actually work, you can go back and watch their presentation, or it's linked through the document. So on the next slide, this isn't a product, but being part of the disaster response team, we've been fielding a new influx of questions about vaccine incentives and ESG-CV. So since I have a captive audience of HUD-funded projects, I took the liberty of putting together a couple slides to address some of our more commonly asked questions. So just to really quick, I know there's a full agenda today, so I won't take too much more time, but can ESG-CV provide incentives to program participants that have had vaccinations prior to engaging in the project? And the short answer is no. These are intended to incentivize vaccines, and you can't incentivize something that has happened in the past. That is the short answer. We'll also get a lot of questions about does everybody have to go into HMIS who is receiving a vaccine? And that short answer there is no. You don't have to enter everyone who gets a vaccine into HMIS. They're treated for reporting purposes like a unique activity, and they're not going to need an HMIS CSV caper to be uploaded. So no project is set up required just for vaccine incentives, but that doesn't mean there's no reporting required for this. There's going to be information on allowable activities in step 5 of your report, and of course, you're going to need to enter all of your financial information on that as well. On the next slide, we've just got 2 more quick questions. Can I purchase any type of gift card to be used as a vaccine incentive? And no, if your organization is using gift cards as an incentive, the gift cards have to be unrestricted. So what does that mean? Not to specific retailers, not to specific restaurants, but generally they have to be able to be used anywhere. And if you do have something like a Visa, MasterCard gift card, the fees that are associated with either the activation or the shipping and handling, they can be included as an eligible overhead cost for the vaccine incentives. And if you're worried about getting monitored, recipients and subrecipients just need to document that in their case files that the gift card included shipping and or activation fees. And last down here, can I offer a cash incentive instead of a gift card? Yep. The notice authorized recipients and subrecipients to make direct cash payments up to $50 a dose for people who are experiencing homeless, again, as an incentive for receiving a vaccine, which also includes the booster shot. And people just want to make sure that they provide cash payments in a way that's accessible for the people that are receiving those funds. So that's it for me. If there's any follow-up questions in the chat, I'll be happy to get to those. Or after this, if you have a burning question, I'll encourage everybody to go to the Ask a Question desk and put your questions in there. And we are always happy to get back to you that way. So Norm, back over to you.
Thank you so much, Brian. And I kind of want to remind everyone that we've been putting up a lot of resources for pretty much 2 years now. And so if you're new to the field or you just don't remember everything that's happened over the past 2 years, and it's been a lot, believe me, then feel free to go back and peruse and go through some of those resources that we've been putting up over the last couple of years. There are just a lot of great resources there, and even occasionally as I've gone back and just browsed the HUD Exchange, there's just a lot of great information that I honestly forgot was up there, and it's still very incredibly relevant today. Thank you so much, Brian. We're going to move to our next presentation, but before we introduce our next speaker, I want to mention there's a poll question. We're going to put up the link to the poll, but there are actually two questions. One is a multiple choice question about whether you expect your community to meet the 50% draw deadline that Marlisa is about to talk about, to have 50% of your ESG-CV funds drawn by June 16th. And the second one is sort of an open-ended question that we were hoping that people would type their responses in this chat window here about how has the notice that, again, the one Marlisa is going to talk about, how has it changed your community's spending plans? So please go ahead and type those in the chat window right here so we can all see that. We will discuss the responses to the poll questions as soon as Marlisa is done with her presentation. But before then, I'm going to introduce Marlisa Grogan, and she's going to do a quick walkthrough of the ESG-CV notice that we just published. So Marlisa, over to you.
Hi, everybody. Good to be with you today. Next slide, please. So hopefully you all had a chance to tune in to the webinar that covered the new notice CPD 22-06 in detail. If you did not, no worries. That's going to be posted on HUD.gov shortly, and we're going to put a link in there in the chat in a moment that will tell you exactly the page that it's going to be posted to under the webinar heading. I'm also going to share a link to the actual notice in a minute too. But this is a brief overview in case you didn't catch the webinar, so you're aware right now what those major changes are. The first is that we have changed the progressive expenditure deadline from 80% by March 31st, 2022, and replaced it with a 50% draw deadline by June 16th, 2022. This is a really important distinction, not only because we're going from 80% to 50%, but also, and that we're going from March 31st to June 16th, but that we're also shifting from expenditures to draws. So whereas in the past we looked at costs incurred for the June 16th deadline, we are strictly going by the amount of funds that have been withdrawn by recipients from IDIS. So that is a really, really important distinction because you really need to get into IDIS and make those withdrawals as soon as possible. If a recipient misses that June 16th deadline, HUD does have the discretion to recapture funds in an amount up to 50% of a recipient's total allocation, that's round 1 and round 2 ESG-CV funds, adjusted by any previously recaptured amount. So if you are a recipient that is having funds recaptured based on noncompliance with the September 2021 deadline, we would lower that total grant amount and then calculate 50% of that lower amount to see what mark you have to hit as far as the 50% goes. Next slide, please. So another huge change is the overall expenditure deadline. What had been in place in the ESG-CV notice 21-08 was 100% expended by September 30th, 2022. Now, as a result of this new notice, there are 3 important dates to pay attention to. The first is September 30th, 2023, at which time you need to have expended 100% of your rapid rehousing, emergency shelter, homelessness prevention, street outreach funds, and then December 31st, 2023, when you need to have fully withdrawn your admin and HMIS. So we're giving an additional quarter for you to use admin funds and HMIS funds, particularly for closeout activities. And then if you are a recipient that receives reallocated funds, you have until June 30th, 2024 to receive those. No one has received any indication if they're receiving reallocated funds or not. The way we're going to be handling that is in we're going to be doing two separate recaptures. One, which is in process right now as a result of non-compliance with the September 2021 deadline. Then as of June 16th, 2022, the 50% draw deadline will result in another recapture, and then we're going to pool those funds together and then issue one reallocation to recipients who qualify. Next slide, please. The notice goes into detail about how HUD is going to process the recapture and reallocation of funds, like the process that I just mentioned, the timing of how the recaptures and reallocations are going to play out. We know that there have been a number of questions about when we estimate reallocations will be available. That's not included in the notice, but a very rough estimate is in the July to August timeframe, accounting for the time that it's going to take to take a look at the numbers and then just run through HUD's internal administrative processes to recapture funds and then run the formula for reallocating them. So there are a number of steps involved, but a very rough estimate is probably in late summer. So on the recipient side, you should keep alert, keep checking HUD.gov. Around that time frame, we're going to be posting the reallocation amounts. We're also going to be emailing recipients directly and letting them know an estimate of the amount of funds available through reallocation. And then we're going to be asking the recipient's authorized official to respond to HUD within a 7-day window to affirm that they do accept the funds and they intend to use them. If there are any recipients that do not want to use the reallocated funds, then we would reflect that in the formula, rerun it, and then redistribute the funds, taking that into account. We're going to obligate the funds via a grant agreement amendment, and that is the step on our part. It's on the recipients to, as soon as you can, amend your con plan. The con plan that you used, or the con plan amendment that you used for your initial award, your initial ESG-CV award. So you're going to go back to your 2019 annual action plan, or whether it was an amendment to an earlier plan, and then make the adjustments as necessary to reflect how you're going to use the reallocated funds. Post it on the government website, and also update your activity funding and activity descriptions in IDIS. And we do have an IDIS fact sheet that can help you through that. And then your con plan, just as a reminder, is the plan that recipients submit identifying the fund, how they're going to use formula program funds, and that's done through the Econ Planning Suite in IDIS. Recipients that are having funds recaptured, they are also required to amend their con plan and also update IDIS to make sure that they are reflecting the reduced award amount. And the IDIS fact sheet that we will link to has instructions for both those processes, which are actually very similar, but there's either a downward adjustment or an upward adjustment depending on the situation that you're in. Next slide, please. The notice also covers several other waivers. The first that's listed here is housing stability case management. So you'll remember that in CPD 2108, the ESG-CV notice, we had waived the 24-month limit on rental assistance and services that are eligible under rapid rehousing and homelessness prevention. What we had intended was for this to be a waiver of the cap across the board. It does turn out, though, that housing stability case management, it actually has two separate caps. One is the limit, which is 30 days for households looking for housing, and then it's a 24-month cap while recipients are in permanent housing. So, and those limits, those caps are in two separate areas in the regs. We waived the one section and we neglected to waive the other section. So what this really just means is that we are now covered, and you all are now covered for to exceed the 24-month cap within 3 years for all services under 576.105 and 106. So if you had not realized that, as many people didn't, please know that this waiver is retroactive, so you're covered even if you had made the assumption earlier on that you were able to go past the 24-month limit for housing stability case management. The other waivers are for state recipients only, a waiver of the obligation deadline. So states typically have 60 days to make that initial subaward to their prime subawardees, so making the initial subaward, and then units of general purpose local government have an additional 120 days to sub-subaward or make the second tier subaward, recognizing that states need additional time to reevaluate where they're at as far as their COVID response goes and how they want to use any reallocated funds. We really want this to be an intentional and strategic decision. We're giving states an additional time, up to 180 days, to make that initial subaward. So that is a waiver granted to states only. Otherwise, we are following the requirements for obligating funds as stated in the ESG regs. And then we also needed to waive the ESG program requirements for reallocation to give HUD the discretion to get the reallocated funds as quickly as possible, and according to the formula that we wanted to use that better targets the funding and then to the areas that we wanted to prioritize for COVID response. So the formula is actually described in the notice and in the addendum, and it describes the two-step process that we're using. One prioritizes geographic redistribution of the funds, and then the second is a national formula that actually directs funds to those recipients that have most funding or most draws for rapid rehousing, and those recipients that drew down the most funds by June 16th. And then finally, next slide. The notice also confirms the deadline or when the waivers applicable to annual ESG grants used for coronavirus response will expire. That's September 30th, 2022. And again, that applies to annual ESG grants used to prevent, prepare for, and respond to coronavirus, which is fiscal year 2020 funds and older. So as of September 30th, 2022, all of the waiver flexibilities that are currently in place will expire. So I know FMR is a really big one that's coming up for a lot of you. If you do anticipate that you'll have funds remaining, older funds remaining to the 2020 and older, and you still need that FMR or other regulatory waiver flexibilities, you can submit an individual waiver for those to keep those ongoing. And you know, you're just going to follow the regular waiver process through your field office, and then just a note that it has to be regulatory, not statutory. And if you have any questions, you can submit an AAQ or go to your local field office, and we will be sure to help you with that. And that is all I have. I will turn it back to you, Norm.
Thanks so much, Marlise. Before you go, we had a quick question about which years does that apply to? You said it, but I think a couple people missed it. The ESG waivers that are expiring.
Yes, so the ESG-CV notice stated, and you should go to section 4 of that notice, CPD 21-08. That is, it gives us the flexibility to provide the waivers and other, additional activities, all of the flexibilities that we provide under ESG-CV to fiscal year 2020 and older ESG grant funds. So there are situations where recipients do have those older grant funds available, but anything starting with 2021 and newer do not fall under that ESG-CV notice. And those, so the 2020 and older, those are the ones that are going to expire on September 30th, 2022.
So that's 2020, 2019, 2018, 2017. Those are the ones where you could use the additional flexibilities, but that authority expires. For the newer ESG 21 and soon to be 22, they just never had those flexibilities that applied to the ESG-CV program. Does that sound right?
It does. There was a mega waiver that we issued in December of 2021 that covered fiscal year 2021 ESG, along with COC, YHDP, and HOPWA waivers. That it did include like an FMR waiver and a couple of other things applicable only to 2021 ESG funds. So that's something to refer to. Those largely expired. They did expire March 31st, 2022. So if, really you should be thinking about submitting an individual waiver for 2021 and newer funds at this point.
Great, thank you so much. So I want to remind everyone that we do have a poll question and want to give you a little extra time to fill out the poll question. Again, there are two questions embedded in there. One is multiple choice question about how you feel about your community's ability to meet the the draw deadline that Marlisa just mentioned. And we're hoping you can type into our chat window here what the impact of the notice has been. Has it helped your community? In what way has it helped? This is really important and helpful information for us. And we're just, to be honest, very interested. So if you could type that in the chat window, that would be fantastic. So we'll give people another minute, but let's actually go ahead and, Micah, maybe we can put up the poll question results. I think you can actually still literally respond to the poll question right now, and it'll show the responses live. But we had some of our recipients who have already surpassed the 50% in draws, which is great news. Some who, many who do expect to meet the requirement, and a few who doubt they're going to be able to meet the requirement, and some who are certain, none who are certain they're not going to be able to meet the requirement, which I suppose is good news. One thing I will say is if you are going to be close, or you feel like if you have a little help, you could get over the hump, please feel free to reach out. We do have some technical assistance available that can help sort of smooth over some of those bumps in getting from expenditure to draw. So if you're a recipient and you're just struggling with what's a better way to do all this paperwork, we would be delighted to help you if we can. So thank you for that. We did get some comments, and please keep them coming in the chat window about getting some breathing room from the notice, and also great comment about not just spending funding to get it out the door, but actually being able to be thoughtful about it. So definitely keep those coming. So want to get to some of the questions in the chat window that we've had. One question that came in much earlier in the session, and we answered it, but I want to bring it up because I think it's really important in light of the discussion today. But the question was about serving sexual assault survivors, and specifically about when they are eligible and when they are eligible under Category 4. So, Brett, I wonder if you could help with that question. and talk about the specific question was regarding eligibility for COC projects. If someone loses housing due to sexual assault, would that fall under category 4 of the definition? And you gave a nice response there. Can you talk about what the different options are here?
Sure. Can I do a sound check? Can you hear me?
You sound great.
Perfect. So my answer was it depends. There's a lot to think about there, but the first thing I clarified was you don't need to wait for someone to lose their housing to qualify them under category 4. If the person believes they're fleeing or attempting to flee sexual assault and they lack the resources and support networks to obtain other permanent housing, then they qualify under category 4 of our homeless definition, even if they're still residing in the housing where they feel unsafe. So that means you can assist them and help them move. If they have already left their housing, if they still feel like they're fleeing or attempting to flee and they continue to lack the resources and support networks to obtain other permanent housing, then yes, they qualify under category 4. It's also possible, depending on where they're residing, like if, say, they're residing in an emergency shelter, then they're going to qualify under category 1 of our definition. So if they've already lost their housing, depending on where they're residing, they may also meet the criteria for another portion of our definition.
Great. And so turning it to, we have been awarding funds under the Continuum of Care program for what we've been calling the domestic violence bonus. Technically, it is domestic violence, sexual assault, dating violence, and stalking. And maybe we should be more clear that those are different issues, but they're all eligible to be served under those funds. Who can be served with those projects? Can you talk about that?
Sure. In those projects, it's individuals and families who are fleeing, as Norm said, domestic violence, dating violence, sexual assault, and stalking, who also then meet paragraph 4 of our definition or category 4 of our definition. So they're fleeing or attempting to flee one of those situations, and they lack the resources and support networks to obtain other permanent housing.
Great, thank you. And we have a question about whether we're going to have more funding for that domestic violence, dating violence, sexual assault, and stalking category in this year's NOFA. We will. We, in our most recent appropriation, received another $52 million for that, so we will be doing another round. So we definitely encourage you, whether you've received funding in the past or not, we definitely encourage you to apply for those funds. And now you've just heard a great example of some of the things you can be using those funds for. So I want to respond to another question that came up about how many COCs received bonus funding, COC bonus funding in the last competition. I think people have questions about how they did relative to other continuums in the funding round. This is a hard question to answer because you can put COC bonus funding in tier 1 or tier 2. I think the question is probably really how many COCs received funding for their tier 2 projects. And I will say it was very few. We needed almost all the funding we had just to get through tier 1 projects. As you know, we funded 100% of tier 1 projects, which is a little different than in past years. But as a result, there was really very little funding. I think at the end of the day, we awarded about 20 million or so for tier 2 projects, which it's a big country. There are a lot of applicants. It is a very small percentage of the tier 2 funding that people applied for. So if you didn't get your tier 2 funds, you were definitely in the majority. So I think those are all the questions that we are able to answer. I know there was an earlier question about AMI calculations that I don't think we really know the answer to, and a couple others that I'm not sure we'll be able to answer. But I do want to thank all our presenters today. We had some great presentations today and a nice, just a nice plethora of information for everyone. So I want to thank our presenters. You all did a great job presenting and have just really interesting information to share with us. I want to thank the SNAP staff, our partners at CDC and in other federal agencies, our partners in the TA community, and want to thank all of you who have been, again, tirelessly doing this work to keep people experiencing homelessness safe, to help them find housing, to help prevent and end homelessness in this country. We deeply appreciate your work. And I personally just am always awed at how innovative and energetic and just creative you all are with the work you do. So thank you for that. I want to close by just wishing everyone a great rest of your Friday, great weekend, and that concludes the webinar.